Hearing loss is a condition where your ability to hear sounds is reduced. This can happen in varying degrees: mild, moderate, severe, or profound. Mild hearing loss might make it hard to hear soft sounds or follow conversations in noisy environments. Profound hearing loss can make hearing almost any sound difficult without a hearing aid or other amplification device. Hearing loss can be temporary or permanent, and it can affect one ear, unilateral, or both ears, bilateral. What's interesting here is that hearing loss is much more common than you might think. According to the World Health Organization, around 466 million people worldwide have disabling hearing loss, and by 2050, nearly 2.5 billion people are projected to have some degree of hearing loss. Types of hearing loss. There are three main types of hearing loss. Number 1. Conductive hearing loss. This occurs when sound waves can't properly travel through the outer and middle ear to reach the inner ear. Number 2. Sensorineural hearing loss. This type involves damage to the inner ear, also called cochlea, or to the nerve pathways from the inner ear to the brain. Number 3. Mixed hearing loss. This is a combination of both conductive and sensorineural hearing loss. Symptoms of hearing loss. Hearing loss often creeps up gradually, making it tricky to spot at first. You might find yourself constantly asking people to repeat themselves or thinking everyone's mumbling. Conversations in noisy places become a real challenge. You might crank up the TV volume, much to your family's annoyance. High-pitched sounds like doorbells or phone rings might slip by unnoticed. Some people also experience tinnitus, which is a persistent ringing or buzzing in the ears, which can be very annoying. You might start avoiding social gatherings because keeping up with chatter is exhausting. Even your balance could be off, as the inner ear plays a role there too. It's not just about missing sounds. Hearing loss can leave you feeling isolated and frustrated. Causes of hearing loss. There are many different things that can cause hearing loss. First up, there's the unavoidable fact of aging. As we get older, our ears naturally start to wear out. It's called presbycusis, and it's as common as gray hair or wrinkles. The tiny hair cells in our inner ears that pick up sound waves start to break down over time. This process usually kicks off around 30 or 40, but you might not notice it until later in life. Sometimes it's just a buildup of earwax causing the problem. Your ears usually do a good job of cleaning themselves, but occasionally they go a bit overboard with the wax production. This can block your ear canal and muffle sounds. It's like trying to hear through a pair of earplugs. Then there's the noise factor. We live in a loud world, and all that racket can take a toll on your ears. Blasting music through headphones, working with heavy machinery, or even just living in a noisy city can damage those delicate hair cells in your inner ear. Sometimes it's not what's happening around you, but what's in your genes. Yes, hearing loss can run in families. You might be born with it, or it could show up later in life. It's like inheriting your dad's nose or your mom's eyes, except in this case, you're inheriting hearing loss. Infections can also mess with your hearing. Ear infections are common, especially in kids, and they can cause temporary hearing loss. But some infections, like meningitis or even measles, can lead to permanent damage. It's like your ears catching a really nasty cold that never quite goes away. Here's a surprising one. Some medications can actually harm your hearing. They're called ototoxic drugs, and they include some antibiotics, chemotherapy drugs, and even high doses of aspirin. Physical trauma can also lead to hearing loss. A knock on the head, a sudden change in air pressure, like when you're flying, or even just sticking something too far into your ear can damage your eardrum or the delicate structures in your middle and inner ear. In some cases, tumors can cause hearing loss. Usually, these are benign growths called acoustic neuromas that press on the nerve that connects your ear to your brain. It's like someone's pressing the mute button on your ear's connection to your brain. Your overall health can play a role too. Conditions that affect your blood flow, like high blood pressure or diabetes, can impact your hearing. Your inner ear is pretty sensitive to changes in blood flow, so if your circulation's not great, your hearing might suffer. Lastly, there's a condition called autoimmune inner ear disease, where your immune system gets confused and starts attacking parts of your inner ear. Before we continue, if you have been enjoying the video so far, Hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of hearing loss. First, your doctor will ask about your symptoms, any exposure to loud noises, and family history of hearing loss. They will also examine your ears to check for any obvious issues like earwax buildup or infections. If hearing loss is suspected, you'll likely be referred to an audiologist for further testing. One common test is the pure tone audiometry test, where you listen to sounds of different pitches and volumes through headphones and indicate when you hear them. This test helps create an audiogram, which is a chart that shows the quietest sounds you can hear at different frequencies. Another test is speech audiometry, which assesses how well you can hear and repeat words at different volumes. Tympanometry is another useful test that evaluates the condition of the middle ear and eardrum. It involves changing air pressure in the ear canal to see how the eardrum responds, helping to identify issues like fluid in the middle ear or eardrum perforations. Sometimes further tests like auditory brainstem response or otoacoustic emissions tests might be needed, especially in infants and young children. These tests measure the auditory system's response to sounds and can help diagnose hearing loss in patients who can't participate in conventional hearing tests. Treatment for hearing loss. The treatment options can vary depending on the type and severity of hearing loss. For conductive hearing loss, the treatment often involves addressing the underlying cause. For example, if earwax buildup is the issue, removal of the wax can improve hearing. Antibiotics or antifungal medications can treat ear infections. In some cases, surgery might be needed to correct structural problems in the ear, such as repairing a perforated eardrum or removing benign tumors. Sensorineural hearing loss, being permanent, often requires more long-term solutions. Hearing aids are a common and effective option. These small electronic devices amplify sound and can be adjusted to meet the specific needs of the wearer. For individuals with severe or profound hearing loss who don't benefit from hearing aids, cochlear implants might be an option. Unlike hearing aids, which amplify sound, cochlear implants bypass damaged parts of the inner ear and directly stimulate the auditory nerve. In addition to these treatments, there are steps you can take to protect your hearing and prevent further loss. Reducing exposure to loud noises is key. This might mean wearing ear protection in noisy environments, like concerts or when using power tools. Keeping the volume at a safe level when using headphones is also important. Now, we want to hear from you. Do you or someone you know have hearing loss? What was the cause of it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.